everyone. This is part of our Worth a Shot series, which is a youth-aware effort to raise awareness about the vaccine and help answer questions that the community has and work towards building herd immunity. So today I am really excited to have Dr. Lukena Karkhanis, who is an internist and allergy and immunology specialist. She practices at Allergy, Asthma, and Immunology Associates of South Texas. She is an active participant in national allergy meetings and has presented and published multiple reports. She also serves as a sub-investigator on several studies at the Allergy and Asthma Research Center. Dr. Karkhanis recently put together a very comprehensive resource on the COVID-19 vaccine for physicians, and I'm very excited to have her here today.
Very nice to be here.
Thank you so much. So, Dr. Karkhanis, the vaccine is finally here, and so many people have questions or concerns about it. And this mRNA technology is a very new technology. So, can you please tell us a little bit about how it works and just a little bit about how mRNA vaccines work differently from other types of vaccines?
Right. So mRNA is what is like a message for our cells on how to make proteins. So our cells basically use this message called mRNA, and that is how all the proteins in our body are made, not just the vaccine proteins. So we usually have our genes stored as DNA, and then it gets converted to what's called mRNA. And then our cells translate it into proteins, and that's how our skin and bones and organs and every part of us is made. Now, the coronavirus, the SARS-CoV-2, which causes COVID-19, has its genes stored as RNA. So these new vaccines that Pfizer, BioNTech, and Moderna have developed, they took the gene for one of the coronavirus proteins called the spike protein, and they made up the mRNA sequence, and that is what is in these vaccines. So the vaccine basically enters the cell and it tells our cells how to make the spike protein of the coronavirus. And once that protein is made, our cells recognize it as a foreign protein, and then they mount an immune response to it. So our body learns to fight against spike protein of coronavirus after we take these mRNA vaccines. And the spike protein was chosen as the target because it's very important for entry of the virus into cells if we were to catch an actual coronavirus infection. So if we know beforehand from the vaccine how to fight the spike protein, if we were to then encounter an actual COVID-19 infection, our body will be ready, our immune cells will be trained, and they can eliminate the virus very quickly before it sets in and causes an infection. So that's how the mRNA vaccines work. They are different from the older vaccines because older vaccines used to actually make the virus proteins outside of our body. They would make it in the lab, in cells derived from either animals or human beings, and then they would purify the protein and inject it, and then our body would mount a response. The problem with that was always that we would worry about whether that protein made in the lab got contaminated with something during the manufacturing process. mRNA vaccines don't have that disadvantage because it's literally like giving a message to your cells, and then your cells can make the protein in a way that's best for you, and there's no contamination with any foreign proteins in the vaccine.
Thank you so much. I think this gives the community a great overview of what an mRNA vaccine looks like and what it does in our body once we receive the vaccine. And I think it's a really important point to note that it can't actually give you an infection. It just, because there is no actual virus in these vaccines. And like I said, Dr. Karkhanis has put together a very comprehensive resource on this, and it also gave a great explanation of why mRNA vaccines are so effective.
Yes, that's right. There is no live virus in any of these vaccines. They cannot give you actual infection. They cannot make you catch coronavirus. In fact, they protect you against catching coronavirus.
So, Dr. Karkhanis, how effective are the Pfizer and Moderna vaccines, and how long after vaccination does it take to develop immunity?
So the Pfizer vaccine and Moderna vaccines are both about 94 to 95% effective against catching symptomatic COVID-19 infection. So even mild infection, they are 94 to 95% effective in preventing you from catching even mild coronavirus infection. They are almost 100% effective in preventing you from catching severe coronavirus infection. So they are very, very effective. Just to give you a rough example, our flu vaccine that we have to kind of take every year is only about 50% effective. So compared to that, these vaccines are almost twice as effective. So highly efficacious vaccines. And we start seeing an immune response as early as 2 weeks after the first dose. But both the Pfizer and the Moderna vaccines come in 2 doses. The Pfizer is taken 2 doses 3 weeks apart. Moderna is taken 2 doses 4 weeks apart. And about 1 to 2 weeks after the second dose is when we start seeing that 94, 95% efficacy in preventing even mild coronavirus infection.
Thank you so much. I think it's just great to know a general timeline of what people can expect in terms of when they can expect to see an immune response or possibly side effects. So I think it's just great to have a general timeline.
Definitely, yes. Now you have to keep in mind you can't give up on all the social distancing and masking guidelines that soon after the vaccine, because there are a lot of us, a lot of people around us who do not have the vaccine yet. And teenagers and children don't have access to the vaccine yet. So we are still going to have to continue mask usage, washing hands, social distancing, avoiding indoor gatherings, but the vaccine will definitely make it much harder for the coronavirus to spread.
Dr. Karkhanis, because the mRNA technology is a relatively new technology, many people have concerns for many different reasons. And one of the main ones is, how is this vaccine developed so quickly? And I know people have many more concerns for many other reasons, and that's why many people are hesitant to take the vaccine. So, are the vaccines safe?
Both the vaccines, the Pfizer and the Moderna, are very safe. The most common side effects seen were what we see with any vaccine. So a little bit of pain and tenderness at the site where you took the vaccine on your arm, maybe some redness and swelling at that site, a little bit of a feverish kind of symptom, maybe some mild body aches, mild headache, which is kind of a side effect of the fact that the vaccine is triggering your immune system to start revving up and fighting the spike protein. And that's something you actually want. So those side effects are very mild, they're temporary. There have been no deaths attributed to the vaccine. And just in the United States alone, we have administered almost 28 million doses so far, and worldwide even more. So highly efficacious, very safe vaccines. We feel like these vaccines were developed very quickly, but the truth is that BioNTech, which Pfizer acquired, and Moderna have been working on mRNA vaccine technology for almost 20 years now. It took them a long time to come this far. They had been trying it for other diseases like Ebola and malaria and things like that. And those vaccines had never quite come to the final stages. And then the pandemic hit, and the scientists were able to quickly shift gears and just shift to using their progress already and just put in the mRNA spike protein. Why were they made so quickly from that point on? Well, resources. So all of these things, vaccine development and trials and scientific research, It requires money, it requires funds, and typically scientists struggle for years to get enough funds. But in this case, given how dire the situation was worldwide, all of these studies and this research was funded by the governments. So the scientists were given a free rein to go full speed ahead with their research. So they had lots of resources. The FDA kind of cut down on all the red tape and the delay that usually happens with approvals, where oftentimes it takes 9 or 12 months to get an answer from the FDA. Here, the FDA agreed to give them their answers in a few weeks, a few months essentially. So that was the other thing that helped with speeding up. And the third thing was, people. People volunteered in huge numbers because we've kind of realized humanity overall how badly we are affected with this disease. So these trials were able to recruit 30, 40,000 people in a matter of days or weeks, which can often take years to convince people to agree to a research trial. So I think that was the main thing, was that people signed up for these trials. And that's why these vaccines could show results so quickly. The science part of it was not rushed at all. The scrutiny was just as intense, and the due diligence was done, and all the steps were followed that we usually follow in any vaccine trial. And so no corners were cut over there in terms of safety and efficacy studies. Everything was looked at, every single incident was reported. Everybody was told over and over, if you have any symptoms, get tested, so that no infections were missed in the trials. The main thing that was speeded up was mainly the support, the resources, the red tape, and then lots of people volunteered. And that's how these vaccines were developed with so-called warp speed. But the science was not rushed.
Yes, thank you so much. And I think one point that you really highlighted, Dr. Karkhanis, was that no corners were cut. It just, the trial process didn't happen in the way that it typically does, but no corners were cut in the process of developing the vaccine. So the vaccines are very safe.
Yes.
So we've been hearing a lot about the new strains of the COVID virus, the new variants, and do you expect that these vaccines will be effective against these new strains?
I think both Pfizer and Moderna have now done studies, and they have found their vaccines are effective against the new strains. The new strains do have some mutations in that spike protein, but they are small mutations. So less than 100th of the protein is changed, really. The rest of the protein is the same, and both the vaccines trigger an immune response to the whole protein. So if a little bit of the protein here and there changes, our immune system still has many ways to recognize the unchanged part of the protein. So what we might expect is that maybe the efficacy will go down a little bit. It might not be 95%, it may go down a little bit, but it's not going to go down to zero. It's still going to be very effective against fighting coronavirus infection in general. Sorry. Will there ever be a coronavirus strain that will have a completely different spike protein? That's hard to say, but it looks like the current spike protein structure is very important to the virus. The virus cannot survive without that spike protein. And it seems unlikely that it will completely change that spike protein, because the virus itself would die out. It would never be able to enter the human cells. It would have no host left. So the hope is that these minor changes here and there in the virus will not affect the efficacy of the vaccine so much that we would have to give up on it. Keep in mind, all viruses mutate constantly, because just like we are trying to survive, they are trying to survive. They are organisms after all. So it's not unexpected, these mutations. But I think the vaccine still will have a decent efficacy even against the new strains.
Yes, thank you so much. And this mRNA technology is just so fascinating. And I think it's also good to know for members of the community who are concerned that it will likely be very effective against these new strains.
Definitely. It's like, think about it this way, a Christmas tree, like everybody decorates their Christmas tree a little differently. But you can still tell that a Christmas tree is a Christmas tree looking at all the different pictures of the trees in people's houses. It's like that. Even if the spike protein is a little different here and there, our immune system can still tell that it's the spike protein of the coronavirus. So if it's been trained to fight it with the vaccine, it will still be able to mount a pretty good response.
So with the flu vaccine, I know that it's annual and people have to get their shot every year. So Dr. Karkhanis, do you expect that people will be needing the vaccine every year?
We don't know yet because we haven't really seen year-long data for the coronavirus vaccine. But the flu virus is very different from all other viruses in that flu viruses, if two different strains are near each other, they can swap their genes and then you can have two brand new strains. So the flu virus has this unique capability of changing large parts of its envelope and proteins very, very quickly. Now, luckily for us, coronavirus does not have that ability. It cannot change large parts of its genome. It can only have minor mutations here and there, small ones. So the hope is that we won't really be needing a booster shot every year with a new strain like we do with flu, but we will have to wait and see. Maybe we will need some kind of repetitive injections, but we don't know how often. The hope is that once we can get a large number of people in the country, in the world immunized, then we'll start seeing a drop in the spread and a drop in the hospitalization and the death rates. And then it will be a question of, well, if most of us are only going to catch a mild case of the coronavirus, then how often should we really get a booster? So we will have to wait and see.
So, please tell us a little bit about the new vaccines which are in the process of approval, especially the Johnson and Johnson one, and what are the big differences between this and the Pfizer and Moderna vaccines that we already have?
So there are two other ones submitted, the Johnson and Johnson one and also the AstraZeneca one. The AstraZeneca one is already approved in other parts of the world. The main difference is that those vaccines don't use mRNA, they use DNA. So what they have done is they have taken an adenovirus, so which is a different kind of virus. They've basically taken one that is not infective to human beings. So it cannot replicate in the human host. For example, the AstraZeneca has taken a chimpanzee common cold virus that causes a minor common cold in chimpanzees, but really does not do anything to human beings. And they put the gene for the coronavirus spike protein in the DNA for the chimpanzee virus. And that is what is in their vaccine. So when you take the Johnson and Johnson or the AstraZeneca vaccine, which are both adenovirus vector vaccines, they're using those non-disease causing adenoviruses as a bridge to put the gene inside our body. Those vaccines will go into our cells and our cells will see that DNA. Our cells have the capacity to change that DNA to mRNA, like I had mentioned before. And then the rest of the process is the same as the mRNA vaccine. Our cells will see that mRNA, they will make it into the spike protein, and then the spike protein will get recognized as a foreign protein, and our body will mount an immune response to it, and our cells will learn how to fight that spike protein. So a lot of the process is similar. There are a few extra added steps in the beginning for this body to take the DNA and make it into mRNA. But again, those vaccines don't have any live virus in them either because the adenovirus vector cannot replicate in the human beings. It's not a human virus. And so those vaccines will also not cause you to actually catch coronavirus infection. The AstraZeneca vaccine is still a 2-dose vaccine. The Johnson and Johnson vaccine, their trials say that they can get away with doing just 1 dose. So that might be the big difference between the Johnson and Johnson vaccine and the other vaccines, in that people could get away with doing just 1 dose, which might make it cheaper and easier to vaccinate more people. But we have to look at their data. Their data seems to indicate about 66% efficacy in preventing all coronavirus infections, even mild, and about 80 to 90% efficacy in preventing severe coronavirus infection. So we might give up a little bit of efficacy for the convenience of getting away with just one dose. But those are the main differences between the AstraZeneca, Johnson and Johnson, and the Pfizer Moderna vaccines. A good way to think about it is like DNA is like the blueprint, right? If you're building a house, you make a blueprint. The DNA is like the blueprint. The mRNA is like the instructions. So once the contractor looks at the blueprint, he has to actually make out the instructions for his workers. When is the plumber going to come, and when is the roof guy going to come, and when is the tile guy going to come? So those instructions, right, are mRNA. And then the actual making of the protein that goes on in our body, that's the actual construction work. So the people come in and they actually look at the instructions and they do their part. They put up the drywall, they lay the foundation, they lay the tiles. So that's the last part that happens in our body. So that's the main difference. With DNA vaccines, the adenoviral vector vaccines, you're giving the body a blueprint, then the body makes its instructions and makes the protein. With mRNA vaccines, you skip the first step and you just give the body the instructions directly, and then the body makes the proteins.
Yes, thank you so much. I think this is a great analogy, and one way I like to think about it too with the mRNA vaccines is that our bodies are getting the instructions to make a food, and our cells are able to replicate that and make it themselves.
Exactly, yes.
And I think that many people are definitely wondering about the other vaccines that are still in their trial process and are still have to be approved in the United States. And I think that there definitely are communities where that might work better.
Yes. And honestly, if people ask me what is the best vaccine for me for coronavirus, it's the vaccine that you can get the soonest, right? Because a very effective vaccine is of no use to you if you can't get it, if it's sitting in a vial somewhere. So all these vaccines, the Pfizer and Moderna right now, they're both very effective, they're very safe. Hopefully AstraZeneca and Johnson will also prove to be the same. And then it's just going to be a question of, what is available when your turn comes up, and then that's the vaccine you should take, right? Because like we say, the way to get done is to start. Like, you have to take the first step. And for most of us, that a very important first step is when our turn comes, take the vaccine that's available to us. And that's how we will start, and that's how we will eventually get done with the pandemic, is by each person just taking their own little first step.
And just one more person getting the vaccine is a huge victory in itself. One more person is protected, and that might have prevented several COVID infections. So it's
Exactly.
so it's really important to know that it's just so important that each person take the step to get vaccinated, and in turn that helps the whole community.
Yes, we each have to do our part.
Dr. Karkhanis, there is a lot of confusion right now regarding side effects of the vaccines, particularly in people with allergies. So which groups of people should be worried about severe reactions like anaphylaxis?
So the main people that we worry about anaphylaxis after the COVID vaccine is people who had symptoms suggestive of anaphylaxis after the first dose, right? Or people who know previously that they are allergic to some ingredient in these vaccines. Those are the only two people we really worry about. Other people that have a history of allergy to other things, other drugs, other vaccines, seasonal allergies, pollen allergies, food allergies, insect allergies, they don't, by virtue of that other allergy, become high risk for allergic reaction to the COVID-19 vaccine. The COVID-19 vaccines have no food protein in them. They don't have any dairy protein, soy protein, nothing. They don't have any preservatives. They don't have any adjuvants. They don't have latex. They don't have gelatin. They really are very, very clean vaccines. So you being allergic to penicillin or sulfa or pollen or egg or anything else really does not make you higher risk for reaction to the COVID-19 vaccine. But it is understandable that people who have a history of allergies are a little more cautious about trying anything new. So for people that have a history of allergies to other things, the recommendation is that you continue your medications as always. Don't stop any of your daily medications. If you have an epinephrine auto-injector, like an EpiPen, take it with you to your vaccine appointment. Like all vaccines, make sure that you are hydrated well, make sure that you're not dehydrated, make sure you've eaten, make sure you're well rested, and stay at the vaccination site for a little bit longer. Most vaccination sites will make people wait for 15 minutes. But people that are concerned about an allergic reaction, I tell them to wait for 30 minutes, because if you're going to have an immediate reaction, it will happen in that time frame, and then you'll be right there and they can treat you. But overall, people with other allergies, really, it's not a contraindication. You should still get the COVID-19 vaccine, because you are a higher risk because of your other allergic conditions to have complications if you caught COVID. For example, if you have severe allergies and asthma, and you caught COVID, you would probably do poorly compared to somebody that had no allergies or asthma. So definitely the benefit of the vaccine is much higher than that small risk of reactions. Now, people who have a reaction after the first dose, they should probably see an allergy specialist like me, so that we can kind of look into it, because a lot of reactions are side effects. They are not allergic reactions. And then we can treat these side effects. And so oftentimes we will still have people take the second vaccine, but we will just be ready for their side effects, and we will treat their side effects, because those side effects are temporary, they're treatable, but COVID infection is not temporary and it's not always treatable. So again, the benefit ratio is more for those people to get the vaccine than the risk. There is going to be a small group of people that will have a true allergy to something in the vaccine. And then those are the people that allergists will really need to test and decide what to do. But that number is very, very small. I think it's down to about 5 in a million or something like that. And even those cases are still being studied. We've given out, like I said, almost 30 million doses in the US alone, and we have very few possibly allergic reactions reported. Most of the others are side effects, or they are unrelated to the vaccine.
And I know, Dr. Karkhanis, that you talked about this a little bit, but I think it's just good for people to know what they can expect when they do go to get the vaccine. So I know that most vaccination sites are having people sit there for about 15 minutes after they get the vaccine. So can you please tell us a little bit about that? What are people watching for, and what can they expect with that?
So most people will be fine. In the first 15 minutes, they really won't feel anything. Their arm might hurt a little bit, and they'll be fine and they will walk out. The reason we usually have you stay is because it's a new vaccine. So we want to make sure we don't miss any severe side effects. Some people will have a very common side effect called a vasovagal reaction, where the trauma of getting a shot can make some people feel lightheaded, dizzy, their heart can start racing, they can feel palpitations, they can feel like they're going to pass out. And oftentimes, just laying flat, right, will take all those symptoms away. And that's why also it's important to be very well hydrated, because dehydration will make these symptoms worse. Some people during this kind of vasovagal reaction might also feel like their throat feels funny. They might start getting very, very anxious, because when you start feeling things like that, your anxiety kicks in. It's very natural. And it can be hard for even a doctor at that very moment to tell you whether this is an allergic reaction and your throat is swelling shut, or this is more of anxiety from a side effect. And that's why it's important to stay there for about 15 minutes, so that there is somebody there to check you. Oftentimes, if your blood pressure is okay, it's not low, you know you're not having a reaction. The small group of people that might end up having like a true allergic reaction, what they might expect is that they might expect a rash, they might expect that they break out in hives or start getting itchy all over right after taking the vaccine. So those are the initial signs to look out for. If somebody feels like they're having an asthma attack, or they feel like their lips are swelling or their tongue is swelling. So the typical allergic symptoms that we associate with anything, right? This is what peanut allergic people watch out for when they eat peanut. This is what egg allergic people watch out for when they eat egg. So similar kind of reactions, but those are going to be very rare. Most people are going to have some other kind of side effect, or they will not have any side effect at all immediately. Especially if you wait 30 minutes and you do fine, then you're mostly out of the danger window. You may have side effects later on. Like I said, like any shot, you may get a little achy, you may have some chills, you may feel like your body is fighting something, it's fighting the spike protein, it's starting to mount an immune response. You may have a little bit of a headache, you may feel like you want to rest for a day or so after the vaccine. Again, those are temporary, they are minor. We treat them, we just ask you to rest and drink fluids. You can take some Tylenol if you need to, and those side effects can be treated as well.
Thank you so much. I think this gives people a great overview of what they can expect when they go to get the vaccine at their vaccination site, and what they can expect when they have to wait for 15 to 30 minutes after they get their vaccine.
Yes.
So what can people with allergies do? How can they avail of the vaccine? I know we talked about this a little bit, but I think it's a common question that comes up in the community a lot.
So for people with allergies, like I mentioned, stay on your medications. Don't stop anything. Don't worry about your daily medications affecting the efficacy of the vaccine. Allergy medications really don't affect the efficacy of the vaccine. If you carry an epinephrine auto-injector, then take it with you to the vaccination site. Make sure you have fluids on you, and just stay there for a little bit longer. Stay there for 30 minutes so you can be monitored. But allergies to other things are not a contraindication to vaccine. So if for some reason somebody is being told that they are, then that is not correct. Then you need to talk to your allergy doctor so that they can give you a letter saying that you're okay to receive the vaccine when it's your turn to get it.
So, Dr. Karkhanis, there are some reports of the vaccines setting off the immune system, such as aggravating joint pain. Is there a correlation between the vaccine and autoimmune conditions?
So far, we have not seen any proven association. There have been no reported cases of new autoimmune disease in vaccine recipients that was due to the vaccine itself. Now, people are going to develop autoimmune disease in life. So eventually, when large numbers of people get the vaccine, we are going to see people that developed autoimmune conditions, but they probably would have developed them irrespective of whether they got the vaccine or not. The vaccine mRNA is very temporary. mRNA in general is very, very fragile by nature. It's gone within a few days from your body. There's nothing left in your body of the vaccine within a few hours to a few days. The rest is just your immune system learning to fight the coronavirus, and that it takes some time. It takes a few weeks to get good at it. And you get your second dose, and it's like, you studied for an exam and you remembered some things, but then a few weeks later you went back and revised it, and you learn even more, you remember, retain even more. It's like that for your immune system. So you get the first dose, you may have some side effects. You get the second dose, you may have some side effects again. But the main thing is that it's not going to permanently stay in your body. It's not going to make your immune system attack your own cells. Our immune cells learn very early, when we are not even born, when we are still in our mother's uterus. Our immune systems learn how to not attack their own cells, and they will remember it till our death. There are very few exceptions, and those are the people that develop autoimmune disease in spite of everything. But most of us do well. Most of us don't have autoimmune disease. The vaccine really should not change that. You have to keep in mind that we are getting the COVID mRNA vaccine now, but our immune system has been fighting millions of viruses our entire life. And all these viruses have DNA and RNA, and they're constantly being inhaled and ingested, and they're trying to attack us. Our immune systems work 24/7, 365. They've learned to fight this DNA and mRNA and all these viruses, and they don't really develop autoimmune disease. Otherwise, we would all have developed autoimmune disease in childhood, given how many viruses there are in the world. So our body has a pretty good, robust way to prevent this. So I don't think there is any concern really to develop autoimmune disease from the vaccine.
Dr. Karkhanis, I know that for children, the vaccine has not been approved yet. So, what can we expect for children? When will they be able to get the vaccine?
So both Pfizer and Moderna have trials going on right now for the adolescent age group. So 12 to 18 or so is the age group that is undergoing trials. And they think that they will have promising results by the fall for that age group. They are also going to start studying younger children, so maybe 6 to 11 years of age in the near future. So it will go stepwise. We'll probably see results, and hopefully they'll be very good for the adolescent age group. And then by fall, we might have a recommendation as to whether those people can get the vaccine. And then in the meantime, we'll have started studying younger children. So every few months or so, we can expect new data to come out regarding whether the vaccine age can be dropped lower and lower. And I think given a few months, we should have much more information about when children can get the vaccine.
Thank you so much. And I think for children, I know the data is going to start coming in, and we might not have all the information yet now, but for the community, it's important for the community to know that data will be coming in, like you said, Dr. Karkhanis, and we'll have more information soon.
Yes, definitely. In the meantime, we take the vaccine, and that's how we protect all the children.
So thank you so much, Dr. Karkhanis, for joining us today. This was very informative, and I'm sure that the community will really love to hear from you and just see all this amazing information that you gave about the vaccine. So thank you so much for this.
Yes, it was my pleasure to be here, and I'm very happy for all the work that you're doing. You're doing a great job. Keep it up.
Thank you so much.